Your blood pressure was fine at your last checkup, but what if it's silently spiking every single night while you sleep? What if something you're doing right after dinner is causing dangerous pressure on your heart, your kidneys, and your brain without you even knowing it? Most people over 60 have no idea this is happening to them. And the scary part is, your doctor may never bring it up. Studies show that nighttime blood pressure is actually more dangerous than daytime readings. It can predict heart attacks and strokes better than anything measured in a clinic. So if your numbers look okay at your appointment but you keep waking up exhausted, foggy, or with a headache, this video is for you. Stay until the end because I am going to show you exactly what to stop doing after dinner and what to do instead to protect your heart while you sleep. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed, and I am so glad you are here today. If you are new here, please hit that subscribe button right now and tap the bell so you never miss a video. This channel exists for one reason, to give you the real information that helps you live longer, stronger, and healthier after 60. Today we are talking about something that affects millions of seniors every single night, and almost no one is talking about it. So let's get into it. Let me ask you something. Do you check your blood pressure in the morning and it seems okay? Maybe a little high, but manageable. Then you go to bed thinking everything is fine. But here is what most people do not know. Blood pressure does not stay the same all night. In a healthy person, blood pressure naturally dips down during sleep. It is called the nocturnal dip. Your body is supposed to rest and recover. But in millions of seniors over 60, that dip never happens. Instead, blood pressure stays dangerously high or even rises while they sleep. The American Heart Association calls this non-dipping, and it is linked to a much higher risk of heart attack, stroke, and kidney failure. According to the CDC, nearly 70% of adults over 65 have high blood pressure. But what they do not tell you is that what you do in the hours after dinner is one of the biggest triggers for dangerous nighttime spikes. And most of it comes down to habits that feel completely harmless. I have been working with senior patients for over 15 years. I have sat with thousands of people just like you, people who were doing everything they thought was right, taking their medications, eating reasonably well, getting some exercise, but their blood pressure was still out of control overnight. And when we started looking closely at their evening routines, we found the same patterns over and over again. These are things most doctors never ask about because appointments are short, and nobody thinks to connect dinner habits with nighttime blood pressure. But I am going to tell you what I tell my own patients, because you deserve to know the full picture. So let us talk about the first thing you need to stop doing after dinner. And this one is going to surprise you. Stop eating a late and heavy dinner. I know that sounds simple, but most people over 60 have shifted their biggest meal to the evening without realizing it. Maybe lunch is light, maybe you snack during the day, and dinner becomes the main event. Your body has to work incredibly hard to digest a large meal. Your heart pumps faster, your blood vessels tighten, your blood pressure goes up. And when that heavy meal happens close to bedtime, your body never gets a chance to calm down before you fall asleep. A study published in the Journal of the American Heart Association found that eating large meals within 2 hours of bedtime significantly raised nighttime blood pressure in older adults. One of my patients, a 68-year-old woman named Margaret, came to me frustrated because her blood pressure medication did not seem to be working. Her morning readings were always high. We started talking about her evenings, and it turned out she was eating dinner at 8 or 9 at night and going to bed by 10. Just moving her dinner earlier and making it smaller made a dramatic difference within 3 weeks. Her doctor was shocked. But the timing of your last meal matters more than almost anything else. And the second habit is even more common. Number 2. Stop drinking alcohol after dinner. Now I know this feels like a social thing, a glass of wine to relax, a beer watching television. And many people believe alcohol helps them sleep. But here is the truth. Alcohol is one of the most powerful triggers for nighttime blood pressure spikes that I see in seniors. At first, alcohol causes your blood vessels to relax. That is why it feels calming. But a few hours later, your body swings in the opposite direction. Your blood vessels tighten. Your heart rate goes up. Your nervous system gets activated. All of this happens while you are asleep, so you do not even feel it. Your blood pressure can jump 10, 15, even 20 points in the middle of the night from just 1 or 2 drinks. And in people over 60, that reaction is stronger and lasts longer than in younger adults. I had a patient named Robert, a 71-year-old retired teacher, who was having terrible morning headaches and felt exhausted every day. He was not a heavy drinker, just 2 glasses of red wine every evening. When we looked at his overnight blood pressure with a 24-hour monitor, his numbers were frighteningly high between 2 and 4 in the morning. He gave up the evening wine, and within a month, his nighttime numbers dropped significantly and the headaches were gone. If you are having any alcohol after dinner, this might be the biggest change you can make for your heart health overnight. But wait until you hear number 3. Number 3. Stop sitting completely still after dinner. I know you are tired. I know dinner time often means sitting down and finally relaxing. But going from the dinner table directly to the couch for the rest of the evening is quietly damaging your blood pressure. When you eat and then stay completely still, blood sugar and blood pressure both spike and stay elevated because your body has no way to use up the glucose and start calming down. Even a short, gentle walk after dinner changes everything. Research shows that just a 10 to 15-minute light walk after eating can lower post-meal blood pressure significantly and help your body start winding down naturally for sleep. You do not need to exercise hard. You do not need to go to a gym. Just walk around the block, walk around your living room, walk up and down your hallway. My patient Dorothy was 66 years old, dealing with borderline high blood pressure and prediabetes. She started taking a 12-minute walk after dinner every single night. Her blood pressure readings improved within 2 weeks, and she said she felt calmer and slept better than she had in years. This one small habit can change your overnight numbers in ways that surprise even your doctor. And what I'm going to tell you next shocks almost every patient I share it with. Number 4. Stop watching stressful or exciting content right before bed. This is a big one, and almost nobody connects it to blood pressure. What you watch, read, or scroll through in the hour before bed directly affects how your nervous system behaves while you sleep. The news is full of alarming stories. Crime dramas and action movies keep your adrenaline elevated. Arguments on social media trigger your stress response. And that stress response releases cortisol and adrenaline into your bloodstream. Those hormones raise your blood pressure. When this happens close to bedtime, those chemicals are still circulating in your body for hours. Your blood pressure never gets the chance to come down. I have seen patients whose nighttime blood pressure improved just from changing what they watched in the evening. One gentleman, Harold, age 74, was watching the evening news and then a true crime documentary every night before bed. His overnight blood pressure was dangerously elevated. We made one change. He switched to calm shows, nature documentaries, light comedies, and read a book before sleep. His nighttime readings came down significantly within a few weeks. Your brain does not stop processing stress the moment you close your eyes. Whatever you feed your mind after dinner shows up in your arteries overnight. Now, coming up at number 5 is something most people think is completely healthy, but can actually be secretly dangerous for seniors. Before I continue, if this information is helping you right now, please take 2 seconds and hit that like button. It truly helps me reach more seniors who desperately need to hear this. And if you have a friend or family member over 60 dealing with blood pressure issues, please share this video with them right now. It could genuinely help protect their heart. Number 5. Stop taking the wrong medications or supplements at night without knowing the timing. This is something I feel very strongly about because I see it cause real harm. Some medications actually raise blood pressure as a side effect. Common ones include certain decongestants like those in cold medicines, some anti-inflammatory pain relievers, and even some antidepressants. Taking these in the evening without knowing their effect on blood pressure can cause dangerous nighttime spikes. On the supplement side, things like high doses of caffeine-containing supplements, certain herbal products, and even large doses of vitamin D taken too late in the day can disrupt your overnight blood pressure. I had a patient named Gloria, 69 years old, who started taking an over-the-counter joint supplement in the evenings. Within a few weeks, her overnight blood pressure started climbing. Nobody connected it until we did a full review of everything she was taking. When she switched the supplement to the morning, her nighttime numbers improved. Please look at everything you take after dinner. Bring the full list to your doctor and ask specifically whether any of it could affect your blood pressure at night. You would be surprised what the answer sometimes is. Number 6 is going to sound very familiar, but the specific reason I am about to give you is one most people have never heard. Number 6. Stop eating salty snacks after dinner. Most people already know salt raises blood pressure, but here is what makes this specifically dangerous in the evening. Your kidneys are less efficient at processing sodium later in the day. Your body naturally slows down kidney function as it prepares for sleep. So the salt you eat after dinner at 7 or 8 at night sits in your system longer, pulls more water into your bloodstream, and raises your blood pressure more than the same amount of salt eaten at lunchtime would. Crackers, chips, canned soups, pickles, deli meats, even some cereals are loaded with hidden sodium. A single serving of some popular crackers has over 300 milligrams of sodium, and most seniors are eating 2 or 3 servings without realizing it. My patient Frank, 72 years old, thought he was eating healthily in the evenings, but he snacked on crackers and cheese every night while watching television. His nighttime blood pressure was consistently elevated. When we eliminated the evening snacks and replaced them with a small piece of fruit or a handful of unsalted nuts, his numbers improved noticeably within 3 weeks. Your kidneys are working hard for you every night. Stop making their job harder after dinner. And number 7 may be the most overlooked habit of all. Number 7. Stop drinking too much fluid in the evening, especially the wrong kinds. Staying hydrated is important, absolutely. But drinking large amounts of fluid in the 2 to 3 hours before bed causes your body to work overtime. Your heart has to pump more volume, your kidneys have to process more, your blood pressure goes up, and then you wake up multiple times to use the bathroom, which also disrupts your deep sleep cycles. Poor sleep itself is a proven cause of elevated blood pressure. It becomes a vicious cycle. Caffeinated drinks like tea, coffee, and soda are especially harmful in the evening because caffeine raises blood pressure directly and also prevents you from reaching the deep restorative sleep your heart needs. I have seniors who switch their evening beverage to a small warm glass of herbal tea, something calming like chamomile or lemon balm, and report significantly better sleep and lower morning blood pressure readings. My patient Barbara, 67 years old, was drinking 2 large glasses of water right before bed, plus a cup of regular tea. She was waking up 3 or 4 times a night, and her blood pressure was elevated every morning. We moved her main fluid intake to earlier in the day and switched her evening tea to decaf chamomile. Within weeks, she was sleeping through the night and her morning readings had improved. Small changes, enormous results. Now here is exactly what you need to do starting today to protect your blood pressure overnight. First, eat your dinner earlier. Try to finish eating at least 3 hours before you go to bed. Make it a lighter meal in the evening and save your heavier eating for earlier in the day. Second, skip the alcohol after dinner completely. I know this is hard for some people, but your heart will thank you. If you want something to wind down, try warm herbal tea or sparkling water with a slice of lemon. Third, take a short walk after dinner every night. Even 10 minutes makes a real difference. You do not need to push yourself. A gentle stroll is all it takes to help your body start processing dinner and calming your cardiovascular system. Fourth, protect your evening mind. Turn off the news. Avoid social media arguments. Choose calming, pleasant content in the hour before bed. Let your nervous system start unwinding before your head hits the pillow. Fifth, review every medication and supplement you take after dinner. Write them all down and take that list to your doctor. Ask specifically which ones might affect blood pressure and whether any should be taken at a different time of day. Sixth, eliminate salty evening snacks. Read labels. Choose low-sodium options, or better yet, replace evening snacking with a small piece of fruit, some walnuts, or plain yogurt. Seventh, front-load your fluids. Drink most of your water during the morning and afternoon. In the evening, stick to small amounts and choose decaffeinated herbal tea if you want something warm and soothing. These are not complicated changes. They do not require a prescription. They do not cost money. But they could genuinely be the difference between your blood pressure staying dangerously elevated all night and your body finally getting the restorative rest it needs to heal and protect your heart. Let me quickly go over everything we covered today so you can remember it. You learned that eating a late heavy dinner keeps your blood pressure elevated through the night. You learned that even 1 or 2 drinks of alcohol causes dangerous nighttime spikes hours later while you sleep. You learned that sitting still all evening prevents your body from calming down after a meal. You learned that stressful media before bed keeps your nervous system and blood pressure elevated while you sleep. You learned that certain medications and supplements taken in the evening can secretly raise your nighttime pressure. You learned that salty evening snacks are processed more slowly and raise blood pressure more at night than during the day. And you learned that too much fluid and caffeine in the evening disrupts your sleep and keeps your blood pressure from dropping overnight. You have the power to change your nights starting tonight. It does not take perfect health or perfect habits. It just takes awareness and one small step at a time. Your heart has carried you through every single day of your life. It deserves to rest properly at night. And now you know how to help it do exactly that. I want to hear from you now. Which one of these evening habits do you think is affecting your blood pressure the most? Leave your answer in the comments below. I read every single one and I love hearing from you. And if this video helped you today, please give it a like and share it with someone you care about. Subscribe if you have not already, so you never miss a new video. Coming up next, I am going to share the morning habits that could be doubling your blood pressure risk before breakfast even starts. You do not want to miss that one. I am Dr. Jessica Reed, and I will see you in the next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.